Happy Sunday, everybody. Thank you so much for tuning into Cool FM Live this morning as we are live with a live Q&A again with Dr. Kohif at Kohif Tailor Health. They changed the game when it came to specialized medicine, precision primary care medicine. And guess what? They're changing it again. We have a special announcement from Dr. Kohif, and we will be taking live questions from you about questions that you might have regarding Kohif Tailor Health and how tailorized medicine can help you. Specialized medicine can help you. Dr. Kohif, so the big announcement is about doing something that a lot of clinics and primary cares are doing right now, and that is going all telehealth.
Yep, that's correct. Thank you for joining me again.
No, thank you. Thank you.
And yes, we're transitioning our model completely into a remote or virtual model, meaning that our patients will be able to do everything virtually. And it makes sense at this point, because the past 4 months, I would say, 80-90% of our patients like that.
They already do it.
Yeah, we've been doing it already. Yeah. So it's almost all the time. And then also because everything we do virtually and we have our system, which is a cloud-based HIPAA compliant system. So you really don't have to come to sign papers or do things like that. Everything is done actually streamlined through our system online. So you can join, your consult online, your follow-ups online. You get the results from the comfort of your home. We can ship whoever wants to do our test, the genetic test. We can ship the kit and the swab home. So easy.
Yeah, that's what I was going to ask about. Probably one of the first questions is, well, you do a lot of good genetic testing to find certain markers for certain things to keep us as healthy as possible using the power of genetics. Well, normally we would come into the clinic to get the cheek swab or to get the sample, and then you would send it out. So all it is you just mail it to us and we mail it back to you.
Yeah. So it's pretty simple. It starts with the free consult with us online virtually again, and then if you'd like to proceed with us, then we, based on whatever test we think is best for you, then we just ship the kit home, and then it comes with instructions and everything, so it's very clear. And then it comes with a prepaid return label as well, so you can just ship it. And one thing that's very important, Jeff, is people ask, is my data private and secure as well? Because we do not share any, the kit that you get, it's just going to have a barcode and that's it. But we internally link that barcode with your patient identifiers. This way, if it is lost or something happens, no one can identify anything.
Right. And again, that's safety and compliance is something that you pride yourself on. And that's why you built the website the way you have. Yeah. And again, we're looking for your live questions. If you have live questions for Dr. Kohif this morning about precision primary care or how that can interact, of course, questions about insurance, that we always have to bring up when we talk about Kohif Pharmagenics, which the website, kohifpharmagenics.com, is in the post description. You can tap that. Because if you would like to have primary precision care, there's only one place that does it, and it's right here at Kohif Tailor Health.
Yeah, that's correct. And also, for people to find us on Google, you can just type Kohif Tailor Health, Tailor Health, one word, and then the same thing. We'll take them to the same website.
Yeah, and it's all right there in the post description. So why don't we kick off with a few questions here. Benefits of telemedicine. We do so much online today. It almost makes sense that is where healthcare goes.
Yeah, there are a lot of benefits when it comes to telehealth. First of all, especially when it comes to chronic ill patients, some of these patients, they have problems moving, and things like that. So with telehealth, you don't have to go to a physical location or a clinic. You can actually just do it from the comfort of your home, joining it from your, phone, or if you have a laptop as well, that's easy. So that's one of the benefits. The other benefit as well is time, I would say. So you as a patient to go see a doctor, depending on where you live, it might take you 20, 30 minutes or even more sometimes if you're in a city where, there's a lot of traffic as well. So you have to plan ahead like 1 or 2 hours at least. Yeah. But with telehealth, it's easy. You're really saving a lot of time, right? Yeah. So the third benefit also is, which is probably unique to us because we don't work with insurance, is, we usually when you work with insurance, the coverage or the reimbursement by insurance is based on time spent. But we don't practice this. And this is why we don't have limitations as well. So it's for example, for our 15-minute consult, it's 15 minutes, but most of the time, actually, some people take 20, 30 minutes. And we're happy to, you know what I mean? So as long as it's benefiting the patients, That's something that's something you can do virtually. I mean, like on site it would be difficult because patients line up and things like that. But virtually, that's something will give you more even time if you need.
So if someone is maybe they are struggling with a chronic health issue, a lot of times you would think that they would need to come in and actually see a physician at times. How does that interact with?
Yeah. So that's a good question, right? So for our model, we really don't need to have people physically, meaning that we don't do like EKG or imaging or things like that, because precision medicine is this is needed sometimes from patients, of course, but that's something I wouldn't say the focus for us, because most of our patients, we work with their doctors already, so their doctors take care of that part of this picture. But with us, our genetic tests, our precision medicine interpretation, and all these different factors that we practice in place, we don't have to really see patients, most of them, physically. I mean, if we need to see patients, then that's something we can arrange, right, for some patients. And by the way, for this place, we might find another place soon, something like this, yeah. But most of the so far, honestly, I would say it never happened when we needed to see somebody like it's like when you have to see them like physically,
right?
Because the genetic test is done, and then our experts and our system, everything is virtual, and you meet with them virtually. They review all of these data online and virtually, and deliver it to you and to your primary care provider. And then it would also make more sense if we were like performing like minor procedures and things like that, when you really need to see people
in person.
So but that makes things much easier for.
So who are the people that someone would see when they log into Kohif Pharmagenics and they decide, yes, I want this to be my primary care, doing a virtual telehealth appointment?
I mean, everybody. So because we really prioritize prevention here, so we this is one of the things we're trying to change, because current healthcare or traditional healthcare is usually a reactive type of healthcare. And we don't want, we really do not prioritize
proactive versus reactive.
It's preemptive here.
Yeah.
So this is for everybody. I mean, the information we provide to you is for lifetime. I mean, it's better to know how your body, for example, respond to medications and things like that before the fact. Imagine, you go to an ER, because we all at some point in our life, we have to go and, be prescribed medication, somebody. Even something as simple as ibuprofen.
Right.
With people like, oh, ibuprofen. Well, ibuprofen can cause a lot of problems to some people. I'm one of them,
Yeah.
So, but it's better when you know that, for example, ibuprofen is not for you. So when you need it, at some point in your life, you know that it's not for you, you avoid it, and you get the alternative that might work for you. So this is just, one example. The other thing is lifestyle. We want to get back to people to lifestyle, because lifestyle should be, or is actually, the first line treatment for a lot of conditions. Diabetes, high blood pressure, hypertension. I mean, it doesn't make sense if you have a kind of a sedentary lifestyle, but then, okay, I'm taking my medications. No, well, this is just, by the way, I'm not against medications,
right?
But for me, I would say, for people to prioritize lifestyle is more important than just being on medications, and when they have sedentary lifestyle, poor diet, poor exercise, and things like that. So, and that's one thing go ahead.
No, well, the interesting part is that's where the genetic tests come in, is that the genetics can tell you what medicines will work best for you, and that's why it's so important.
This is one of the tests. It's called PGX test, and the application is in a lot of specialties and fields. For example, I would say the top 3 ones are, we're talking about oncology, people with cancer, cardiology, and psychiatry. And psychiatry is a big one as well. Why? Because usually anti-psych meds, especially antidepressants, usually it takes 6 to 9 months for them to work. So imagine you're starting on a medication, you wait 6 to 9 months for it to work, but then you know that it's not for you. And then you are
all that time is missed.
All this time is missed, and you suffer, right?
Yeah.
But our panel here covers genes that can tell us, for antidepressants and anti-anxiety, sleep aid medications, all this kind of different type of medications. It actually tells us what works for you and what doesn't work for you. So And it's not 100% because the human body is complicated though. But I mean, we see it clinically.
Yeah.
You know, we can talk about the examples in a bit.
Of course.
But you know, yeah. So psychiatry is a big one. Oncology.
Yes.
There is a gene that we test here. Just one. We test for five genes when it comes to cancer. But then there is one of them that the FDA just updated the label for that medication, because that medication is a pillar of chemotherapy for patients. It's called capecitabine and fluorouracil. You know, it's given to patients with many different types of cancers. Right? There is actually a gene. If you have a certain copy or a mutation of that gene, it puts you in risk at least 100 times more than regular people.
Wow.
So you get toxicities, chemotherapy, toxic effects, myelosuppression, horrible side effects. But when we know, then we can switch you or your oncologist tell them, hey, that's not the one for you, and then probably you need another chemotherapy. So that has all. I mean, in oncology, the PGX test is really, really important.
Yeah.
So oncology, psychiatry, and cardiology, many other fields, but these are the top three. There is a medication that's given to people, you know, especially after they place a stent. It's called clopidogrel. It's probably one of the most prescribed medication, Plavix. That trade name is Plavix. And then probably it's one of the early medications where we developed actually PGX guidelines for, and it's actually on the FDA drug label as well, right? So it's endorsed and recommended by the FDA. Anyway, that medication reduces, you know, blood clots and you know, your risk for stroke and things like that. And imagine it's one of the medications that we take as inactive, you know, meaning that the body activates it, makes it effective in the liver especially. So there is a gene called CYP2C19. So imagine you don't have that gene active. Now what happens? You take the medication, it's useless,
right,
and thinking it's working for you, but then you puts you in more risk to get stroke and things like that. And we see this, we see this in the clinic, and many examples throughout the past 3 to 4 months, I would say, in all these different, you know, specialties. But of course, we help with many other specialties like pain management, you know, gastroenterology. I mean, there's 17 medical specialties really. So
yeah, it's incredible to think about, because you know, we know that there's so many different aspects to our daily health, but the fact that genetics can tell us, just a simple cheek swab can tell us so much about the medications that we're on and how that affects us and what medications will work best for us. We're live with Dr. Kohif right here at Kohif Tailor Health, kohifpharmagenics.com. You can see that website in the post description. We're taking your live questions here. So if you have questions for Dr. Kohif about the process of being able to do the genetic testing and how important that is to our health, looking not just at the present, but literally looking at the future. It is the future of medicine now, but it can also tell your future to, you know, to a certain degree of what could be coming. Yeah,
because, there are two types. One thing, you know, because this is all about education, right? We'll educate people because genetics is something new, right? There are, I would say, two types of genes in our body, right? The first type is called germline. Germline meaning that's what you inherit from your parents. One copy from your mom, one copy from your dad, and then you pass it to your offsprings and the offsprings, right? And then there is a type called somatic. Generally, you know, all our cells in our body, you know, your skin cells, your liver cell, your eye, whatever it is, your hair cells, you know, they contain actually the same genome, the same DNA, right? So this is a type of genetics that where we tell people they don't change. Okay, so PGX fall within this type of, I would say, genomics. So meaning that when we tell you you're a poor metabolizer receptor D6, those medications are not going to work for you. That's for lifetime. You know that, done, right? But then the somatic, that's only the exception which is for cancer. Right. So people with tumor and cancer will have its own microenvironment and its own genome that's different from the germline or from the rest of the body. That's a whole different scenario. And this is why people with cancer, if we want to do a new test, we talked about before, we're going to introduce soon, the tumor molecular profiling. We can't do that with a cheek swab. That has to be a biopsy taken out. Why? Because if we do a cheek swab, we're not getting the right DNA now, right? So, yeah, so because this is usually, when it comes to tumor, it's an acquired type of genome. It's not the actual personal genome that you were born with.
Right.
Yeah, but back to your point, the clinical test we offer here, they are for lifetime. And the other one, the NGX, we talked about the PGX, the NGX, I mean, that, you know how your body breaks down diet. You know how diet impacts your genes and your body. You know what you're deficient in. It could be something as simple as folic acid deficiency that's causing you anxiety and depression.
Yeah.
And you've been on tons of antidepressants for years and not knowing that actually the root cause for this is just you're deficient for something as simple as folic acid, vitamin B, something like that,
Wow.
If you're at risk to develop certain conditions as well, and work towards, avoiding, again, it's all about prevention, right? So
yes.
That's what we prioritize. But because the traditional healthcare is almost reactive all the time, so most of our patients come after the fact. But then we're trying to balance, helping these people, but also help them manage, their care. So this way, they avoid many problems that can happen in the future as well.
Proactive versus reactive medicine here at Kohif Tailor Health. Now online virtually at kohifpharmagenics.com. You can, as you mentioned, Dr. Kohif, you talked about a vast majority of your patients already do the telehealth, but you still give the free 15-minute exam as well. The free exam.
That's still around, yeah. It's free 15-minute consult, You meet with either me or somebody else on the team online virtually, and it's all free, So.
and that's the first start, is that free exam, being able to, the free consultation, to be able to talk about maybe what your health concerns are. And
Absolutely.
if you have certain health concerns today, we're taking live questions. I know that one of the questions that does come up is all about insurance. And I know that's, we got to, it is the elephant in the room so often with how people perceive medical care, with how people how Americans have understood medical care. It's all been via insurance. But the packages that you offer here at Kohif Tailor Health, they're completely affordable. They're for all pay scales. And of course, the free consultation to start with, everybody loves that. And then getting in on the ground for the genetic testings, which costs thousands and thousands of dollars when you do it somewhere else. And then insurance is involved in that process. Yeah. But here, because of the $99 price tag, or at the most, sometimes even less, starting at $49 all the way up to $99, being able to do that, it makes it so affordable to get those answers and have proactive medicine.
Yeah. I mean, I would like people to know that it's not that we cannot work with insurance. We can work with insurance. But the thing is, insurance puts restrictions and limitations in place. And if we go down that route, then we'll have to listen to insurance. And again, we're not attacking insurance companies, but it just one of the challenges in the field, in healthcare anyway, right? So for us to practice freely, based on what you deserve as a patient, based on your unique biology, then we know that we can't work with insurance, because at the end of the day, most of our genetic tests that we perform, they're not covered anyway. So why the hassle for something that is going to be denied, and then get the surprise bills and all these different things, right? So I would say because this is quality-driven care, 100% really, and this is why if we work with insurance, we have to compromise some of what we do, and we're not willing to do that. Actually, insurance financially will benefit us more. Just allow people to know that insurance will benefit us more, but we're actually sacrificing financially for you, because this is all about a change in healthcare, not just the clinical model from a one-size-fits-all care into a one that takes into consideration your unique characteristics, but also the financial model, And we understand that sometimes it gets hard for people because they can't afford it. And that's why we have tiers and plans in place. Well, literally, I'm going to throw it out there. We literally have some people sometimes like, I can't pay. We're like, for that visit, whatever, that consult, we're like, okay, it's fine. We do that here sometimes. And one of the things we're thinking about in the future is having a financial assistance programs. We're not there yet, but we hope to get there soon. So people who can't afford certain, tests or certain, services, they can just fill out a financial assistance application, and then we can cover this for them. But again, we don't work with insurance. We don't sell your data to anybody. We're completely changing the model, so there's no any source of income really for us.
Which is the amazing part. And again, you can ask your questions for Dr. Kohif. We got John monitoring the live chat right behind the screen here, right behind the camera. And I know that the one question that people have asked often is, okay, precision primary care, you think of adults, but this is for the entire family.
Yeah, that's for everybody. Yeah, I mean, even for kids, especially kids in the US, there is a lot, I would say a high percentage of kids that have ADHD, autism, and things like that. And they're usually put on medications. And this all comes, that takes us back to what we just discussed, with psychiatry. So we help the kids as well, So that's for everybody. Because think about it. I like one of my patients because we had a patient the other day, and he actually told me something that's motivating as well. He said, we have over 7 billion people, worldwide. So you have 7 billion people to help. And I liked that. So it's just for everybody, because this is healthcare, and you don't have to use us as primary care again. We work with healthcare providers, PCBs, all the time. They refer patients to us. They consult with our experts on genetic tests and things like that, or on precision medicine, because we understand this is new. So a lot of providers, there is a lack of education when it comes to precision medicine. So you don't have to use us. A lot of our patients actually just use us precision medicine, So we provide the precision medicine layer, and then your primary care provider can do that, whatever, the primary care as well. So we have both models. So.
And that's a great point, because for many people who already have a primary care physician, you could just be an added benefit to the primary care that they're receiving from their current physician here in Cochise County or Southern Arizona, or worldwide, as this is going out live here on Cool FM Live this morning on a happy Sunday morning, hanging out with Dr. Kohif, answering questions about these amazing steps that you're taking in order to make healthcare accessible, make healthcare affordable, and make it proactive rather than reactive,
and unique as well, because the one size fits all care doesn't make sense, because that's one of the things I would say, one of the challenges in healthcare is, and people understand as well, it's the frustration that comes with it, which is always gonna hit me with those pills, and and see what happens. But that especially now when we have technology that we didn't have access to in the past, we have technologies now we can actually know what actually works for you and what doesn't, So, and why not? Why ignore this, and just try to continue with whatever, No, we, and this is something. I mean, it's not something research. It's something that's clinically valid. And here we're the first ones. We took the initiative to do that, and we see it for 4 months now at least. We see the change.
So, and let's talk about some of the examples of patients that you have seen that maybe they have a primary care physician somewhere else, but they've come here for that precision medicine.
I mean, like, a couple of days ago, for example, there is a patient who was referred to us by a primary care physician, and then they were put on medications for, they have an anxiety and, feeling depression, things like that. So it was a psychiatry patient, I would say. But then they're put like 12 medications, right? And then it's difficult because now it's all about trial and error, guessing what would work. And then we were able to actually help them to evaluate their medication profile and the medical history, not just the whole thing, their lifestyle, exercise, and everything, just to make sure we're not missing anything, right? And then when the genetic test results came back, and then it was interpreted using our system and our experts, we found out that 6 or 7 medications they were on were not for him actually. So that explained why he was having side effects and adverse reactions and things like that. And then we switched. We talked to the primary care provider, and then one of our specialists online, they met virtually with them actually and made sure that they put him on the right medication and cut off a lot of medications. Because this is one of the things,
that's the important part too, that you think of, okay, the medications that you're taking that aren't effective because you haven't had the genetic testing to know exactly. Like you said, we're talking with Dr. Kohif here at Kohif Tailor Health, and as you mentioned earlier, you said sometimes people can be on medications for months, for half a year before it's supposed to start taking effect. And if that one is not tailored to their genetic makeup, it's wasting time.
It is. And not just the time, I mean also the suffering.
Yes.
I don't want people to suffer, especially when it comes to depression and things like that. It's very serious, So,
very.
So I mean, that's just one example. Like we have examples in cardiology, oncology. We have cancer patients, we help them and they felt completely different. I mean, a huge improvement when they were told, hey, this is the dosage you're supposed to take now. You've been put on an overdose, but how to tell without having these insights in place? So, and cardiology, people who, put on a stent, but then that medication was not working for them, and then we were able to help their primary care to switch to and their cardiologist as well, to switch them off, to the medication that probably is more appropriate for them, and I mean, and on the other side, a lot of our patients come for, I would say, for wellness and prevention. So that's something that, people our experts online work with you also to develop like diet plans that are good for you, nutrition plans. We're thinking actually to have dietitians as well soon in place. So this way you can actually do virtual consult with actual dietitians, nutrition specialists that will help based on the genetics can tell you what diet is better for you. And it's huge when it comes to that prevention. You might not see it, right? Because usually when it comes to reactive type of medicine, people see the change quickly because, when something is causing harm to you and you come after the fact and we stop it, then you feel the change. But when it comes to prevention, it's something that's, I would say, long term, right? That's us working with you to help you prevent, development things like diabetes, celiac disease, and things like that. So yeah.
It's an amazing process, and again, it's changing the game here. The way medicine works in Southern Arizona through Dr. Kohif at Kohif Tailor Health here in Sierra Vista, but serving patients through telehealth now, being able to use telemedicine for genetics and being able to work with other primary care physicians for those patients at those places.
And genetics, again, we're against genetic reductionism, meaning we don't claim that genetics is everything. No, it's not. The human body is very complex. So if you want to look at it as a big multifactorial puzzle, genetics is a big piece of that. But then you have lifestyle, diet, nutrition, and exercise. But then you have also environmental exposure, smoking, alcohol, caffeine, these factors as well. And then age, weight, because this is something that I think, or any healthcare provider, they should take this factor into consideration. Your age and weight, because we know when we age, the body and the biological processes change, of course. When you're a child, it's not like when you're an adult, not like when you're elderly, right? Mm-hmm. So taking all these different pieces of the puzzle and try to practice it in one place. Because this is one of the biggest challenges in the field, Jeff, which is data silos. Doctors usually don't have access to these pieces. And if they do, they have to go to different places, and it's a bigger challenge. But with our system, we're gathering all these factors in one place for our specialists and providers. So this way, easily, they can access all this information. Because one of the frustration in healthcare as well is when people go to see different specialists, it's usually in silos. Because that specialist, they take care of that part of things. But then they go to other specialists, they're not aware of that. And patients are lost in between, and that's not good. So we actually built a portion of our system that takes all this. For example, when it comes to medication profile, we have a section for current medications that it's either in psychiatry, cardiology, oncology, whatever, in one place, and then you're able to get insights based on all of them combined with all other factors. Wow. So this is one of the biggest challenges, data silos, because patient data lives in fragmented, I would say. Yes. So that's something as well we overcome with our system.
And again, being able to be so unique in the way that healthcare is moving forward through Kohif Tailor Health. Yeah. There's something powerful about that, to know that you are a unique individual. You are someone that is not cookie cutter. This is not one size fits all healthcare, and healthcare should not be that way. But we've ingrained in ourselves that, okay, well, you have this wrong with you. You need this medication. Yeah. And that's not always the case.
Oh, it's not. Again, we have to talk about it again, but unfortunately it's insurance, I would say. Because even EHR systems used by healthcare providers and clinics these days, it's built around how to build insurance, how to get reimbursement. It's not built around patient quality. So insurance is a big barrier to a better healthcare. But that's one thing. This is why we don't work with insurance, because we know if we go down that route, we know how things will wind up. But anyway, what I want to say is because we don't work with insurance here, our system is I would say getting all these different factors, because that's what we believe in. We don't believe that human body and human conditions and diseases should be reduced to something that you need can be solved with some pills. No, it's not. It's way more complicated than this. And then think about this again. Prevention should be the priority. Okay, and because healthcare, the way it's been practiced, it's been practiced based on reactive type of after the facts,
right?
And this is why for people now it's like, okay, if I live my life normally, I feel like I don't have conditions, I'm okay, but that doesn't mean that I'm not gonna develop something in the future, right? So what we're trying to do here as well is to let you know That's how your body responds to diet. That's how your body responds to things like that, based on genetics and other factors as well. Because this is huge for you. To know that you're going to have diabetes and prevent it is completely different from having diabetes and coming to us after the fact, right?
Yeah.
So, because that's what we believe in healthcare should be. Healthcare should not be based on volume, reimbursement, and things like that. It should be based on your unique biology, your unique needs, without insurance restrictions, without insurance limitations. Yeah.
And being that this is Valentine's weekend, cardiology again, I want to touch on that because what is it? Cardiological issues. It's one of the leading causes of death in the United States. And how can that precision health care help in that instance?
Yeah, we know that cardio health is really, I would say, related to lifestyle.
Okay.
Right, exercising.
Because it's a muscle. It's like working out and
exercising, lifestyle things like your diet, your nutrition. There are a lot of things out there that might cause already blockage. Things like that's all related to our cardio. So I mean, that nutrigenomic test we perform, that's actually, I would say, if we want to talk about a specialty that's going to benefit a lot from that, it's cardio. There's no question about it because of all these different sites, right? So this is one thing. But then because a lot of our patients are coming after the fact, the ones that are on medications, again, we can help with that as well on the PGX side of things, telling them, hey, that's medication not working for you. I mean, you're talking about cholesterol medications, atorvastatin and all the statin family. Actually, we do have genes that process those medications. And we see people all the time, I'm fatigued, they have muscle and things like that. And we see it. It's because of the genes that they have deficiency in. So, I mean, we help cardiology patients, like one of the top 3 people that can benefit from our services. So yeah, I mean, on the PGX side and on the prevention side as well.
And let's talk about the costs. So before we wrap up here, we're with Dr. Kohif at Kohif Tailor Health. That is going 100% telemedicine for the time being. And you can make your appointment through their website, which is in the post description. Of course, taking questions live. We have questions that we've answered before on previous Q&As, and there's certain questions that we have today. Thinking about the steps of the cost and how that is lined out for these different tests, for these genetic tests.
I mean, the first consult is always free, so that's something is never going to change, because I mean that's something we sacrifice our time for, because again, we want people to know what this is all about. It's all about education. It's a new thing, and the 15 minutes is for this, so people know what this is all about. And I'm not going to say if this fit their needs, because again, we said our target is everybody, because this is really for everyone, right?
Yeah.
But then if you proceed the genetic test, we're working on reducing the price more with the lab that we do have. But then it's usually starts at $99, and then you combine it with all other things in place. The logistics side of it, which is shipping, carrying, interpretation, 2 free consults with our experts. It's all included in the price. So
for $99.
So $99, that's the genetic test. But then when you add everything else with it, so we have a basic panel that's going to be $299. And then we have the $599. It used to be $799 and $999 last year. We reduced it to $599 now, actually.
Wow.
For people. That covers 75 genetic tests combined. That covers things like your medication response, your diet response, your risk for certain disease, and then with it, the other things, the phenoconvergence, the lifestyle, the medication profile, the interactions, all of this is included within that same price.
And again, diet and exercise, obviously 2 main things for overall health, but finding the unique side of what precision primary care is. Kohif Tailor Health changed the game, and they continue to do it as they go to telemedicine here. And how would someone sign up to do that?
Just on our website, probably if they go to that link on the post description, and then they will go on our homepage, and there they should be able to book a free 15-minute consult and just meet with us virtually. Yeah, it's so easy.
The virtual appointments are waiting for you at Kohif Tailor Health here in Sierra Vista, but serving all of Cochise County, all of Southern Arizona, and all 7 billion people in the world. That's what Dr. Kohif said. 7 billion of you watching right now.
This is the goal. Yes.
That's the exciting part about the way medicine is being shaped and the future of it. The future of medicine
is here.
It is here. It is now, and it is through genetic testing to be able to make sure that you are getting the right mix of of the medications that you need for whatever your health issues are.
Yeah, and also, your risk for certain disease, and then your diet, what diet works for you if you had deficiency. Yeah, so I mean the whole umbrella called precision medicine, or personalized medicine. So.
It's absolutely awesome. Obviously, we've answered every single question that you have wanted us to ask, because there haven't been any questions that John has had in the live chat here. So we'll let it go. And if you do have questions, just sign up for that 15-minute consultation at kohifpharmagenics.com. The information is in the post description. We hope you guys have a wonderful Valentine's weekend. And Dr. Kohif, thank you so much for letting us stop by and chat with you this fine Sunday morning. We're so grateful for you and everything that you continue to do for the unique health needs of the patients that you serve here in Cochise County.
Thank you so much, Jeff. And, you've been doing a great job. And your support has been amazing, so I appreciate it. And people support as well. That's something I appreciate, honestly. So,
well, we appreciate you. Thank you guys so much for watching. And if you do have some questions, maybe you're watching this video after the fact, we will be checking. And Dr. Kohif and his staff will be checking those questions that come in. But you can always get that free 15-minute consultation at kohifpharmagenics.com. And telehealth. Telemedicine, virtual medicine. It is here, it is now, and it is live at kohifpharmagenics.com. Check the post description for all the details. Thank you so much for watching, and please do us a favor, share this video around. This is one that you want to share with your family, with your friends who are maybe looking for another avenue of precision primary care or precision care in your medicine. or in your healthcare. This is the place to be. So thank you so much for watching. Thank you for sharing. Thank you for inviting your friends to like and follow Cool FM Live with all the amazing things that we cover, including amazing healthcare providers like what Dr. Kohif does here at Kohif Tailor Health in Southern Arizona. Have a great rest of your Valentine's weekend, everybody, and we will check in with you again later on. Thank you so much, Dr. Kohif. Great to see you.